Thank you.
The session is called to order. Everybody is requested to rise for the singing of the national anthem. remain standing for a minute of silent prayer and meditation. Majority Leader. The second.
Good afternoon, Madam Speaker. I move that we call the roll of members.
The Secretary is directed to call the roll of members.
Roll call of members. Honorable Representatives Abad, Abaya, Abayon, Abellanosa, Abu, Abueg, Acharon, Akop, Acosta, Acosta Alba, Adiong, Adbincula, Agaraw, Agabaw, Aglipay Villar, Albano, Alcala, Alejano, Almario, Almonte, Alonte, Alvarez Franz, Alvarez Mercedes, Alvarez Pantaleon, Amante, Amatong, Andaya, Angara Castillo, Antonino, Antonio, Aquino Magsaysay, Aragones, Arbizon, Arcillas, Arenas, Atienza, Aumentado, Bagao, Bagatsing, Bagilat, Banal, Barbers, Barsaga, Batawil, Batocabe, Bautista Bandigan, Belaro, Belmonte Feliciano, Belmonte Jose Christopher, Belmonte Ricardo, Benitez, Bernos, Bertiz, Biazon, Billones, Biron, Polilia, Bondoc, Bordado, Bravo Anthony, Bravo Maria Vida, Brosas, Bulot Begtang, Cagas, Calderon, Calixto Rubiano, Caminero, Campos, Canama, Cari, Casilaw, Castelo, Castro Franz, Castro Fred, Catamco, Cayetano, Celeste, Serapica, Ceriles, Chavez, Chipeco, Coanco, Colliantes, Cortés, Cortuna, Cosalan, Crisólogo, Cua, Cuaresma, Cueva, Dalipe, Datol, Daza, de Jesús, de Venecia, de Vera, Defensor, del Mar, del Rosario, de la Osa Montalia, Imaporo Abdullah, Imaporo Mohammed, Duabit, Durano, D, Elago, Enverga, Erice, Erigel, Ermita Buhain, Escudero, Espina, Espino, Estrella, Eusebio, Ebardone, Fariñas, Fernando, Ferrer Juliet, Ferrer Luis, Feriol, Lorendo, Flores, Fortun, Fortuno, Fuentebella, Garbin, García Gwendolyn, García José Enrique, García Albano, Garin Oscar, Garin Sharon, Gasataya, Gatchalian, Heron, Go Ana Cristina, Go Mark, Gomez, Gonzaga, González Alexandria, González Aurelio Dong, González Fernando, Goriseta, Gulias, Hernández, Herrera D, Hopper, Alos Hos, Javier, Ko, Konghun, Labad-Labad, Lacson, Lagman, Lanete, Laugan, Lasatin, Leachon, Lee, Lim Kai Chong, Lobregat, Lopez Benher, Lopez Carlo, Lopez Manuel Luis, Loyola, Macapagal Arroyo, Maceda, Madrona, Malapitan, Manalo, Mangawang, Mangodadato Suharto, Mangodadato Sahid, Marcoleta, Marcos, Mariño, Marquez, Martinez, Matugas, Meliana, Mending, Mendoza, Mercado, Mirasol, Montoro, Nava, Nieto, Noel, Nograles Jericho, Nograles Carlo, Nolasco, Nunez Malañaon, Oaminal, Ocampo, Olivares, Ong Edwin, Ong Henry, Ortega Pablo, Ortega Bini Nola, Pacquiao, Paduano, Palma, Pancho, Panganiban, Panotes, Papandayan, Pichay, Pimentel, Pineda, Plaza, Primicia Sagabas, Kimbo, Radaza, Ramiresato, Ramos, Relampagos, Revilla, Roapuno, Robes, Rocamora, Rodriguez Isidro, Rodriguez Maximo, Roman, Romero, Romualdez, Romualdo, Roque Hari, Roque Rogelio, Sakdalan, Sagarbaria, Sahali, Salceda, Salimbangon, Salo, Salon, Sambar, Sandoval, Santos Recto, Sarmiento Cesar, Sarmiento Edgar Meri, Sabeliano, Sema, Xiao, Silverio, Singson, Swansing Estrelita, Swansing Horacio, Suarez, Si Alvarado, Tambunting, Tan Angelina, Tan Milagrosa, Tan Cherny, Tejada, Tebes, Tianco, Ting, Tinio, Tolentino, Treñas, Tugna, Tupas, Turabinataman, Ti, Umali, Unabia, Ungab, Unico, Uy Juliet, Uy Rolando, Uy Barreta, Vargas, Vargas Alfonso, Velarde, Velasco, Velasco Catera, Veloso, Vergara, Villapuerte, Villanueva, Villaraza Suarez, Villarica, Villarin, Biolago, Yap Arthur, Yap Melesio, Yap Victor, Yu, Zamora Maria Carmen, Zamora Ronaldo, Zarate Subir. Madam Speaker, the roll call shows that 203 members responded to the call.
With 203 members responding to the call, the chair declares the presence of a quorum. Majority Leader.
Madam Speaker, I move that we approve Journal number 31 of the session on October 2, 2017.
Is there any objection? The chair hears none. The journal number 31 is approved. Majority Leader.
Madam Speaker, I move that we take up unfinished business. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we resume consideration of House Bill 6452 in Committee Report 393, and upon motion approved, please direct our Secretary General to read the title of the measure.
The Secretary General is directed to read the title of the bills.
House Bill number 6452, an act establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the rights of persons utilizing psychiatric, neurologic, and psychological health services, and appropriating funds therefore.
Majority Leader.
Madam Speaker, the parliamentary status is that we are in the period of sponsorship and debate. And for that, I move that we recognize the distinguished chairperson of the Committee on Health, the Honorable Helen. I'm sorry, Madam Speaker. To continue the sponsorship of the measure, rather, I move that we recognize the Honorable Chiki Roa.
Honorable Chiki Roa is recognized.
And to interpolate, Madam Speaker, I move that we recognize the distinguished gentleman from the 1st District of Albay, the Honorable Edsel Lagman.
Honorable Edsel Lagman is recognized.
Thank you, Madam Speaker. Will the distinguished sponsor yield to a series of clarificatory questions?
With pleasure, Madam Speaker.
I would like to preface my interpellation with a statement that I am 100% in favor of this bill, which is a measure that is long overdue. Because of the significance of this bill on mental health, I would really appreciate if more members of the House would participate in the debate so that at the proper time, perfecting amendments can be introduced from the substantial to the typographical. It is truly significant, Madam Speaker, distinguished sponsor, that this bill gives importance to community-based mental health care. The World Health Organization states, and I shall paraphrase that statement, that community mental health services are more accessible and effective, lessen social exclusion, and are likely to have less possibilities for the neglect and violations of human rights that were often encountered in mental hospitals. The Commission on Human Rights, in its position paper submitted to the sponsoring committee, reiterated the above statement when it said, and I quote, "The absence of community-based mental health care means that the only care available in psychiatric institutions which are associated with gross human rights violations, including inhuman and degrading treatment and living conditions." Verily, Madam Speaker, distinguished sponsor, since this bill is right-based, a less intrusive and more open environment in community-based mental health care facilities needs to be encouraged and enhanced. Now to my first question. May we know, distinguished sponsor, if the purpose of this bill is to, quote, evolve from a predominantly hospital-based mental health care system to a comprehensive community-based mental health care system, which shall consist of A, mental health care service development, capacity building, reorientation and training, and research and development, as proposed in one of the bills consolidated in this substitute bill, House Bill number 6452.
Thank you very much to the Honorable Lagman for that question. Before I proceed with my answer, I would like to just thank the Honorable Lagman for the support that he has demonstrated and has reiterated. He has told me before that he is in full support of this measure. To the community-based health care that is being proposed in this bill, precisely as he mentioned, this is the thrust of the DOH now, as is the thrust of most of the systems all over the world. Community-based health care acknowledges the fact that, particularly in third world countries, it is difficult for those who need the service, for the service users to access the kind of treatment that might be available in hospitals as we have been used to. What we want to accomplish with this bill is for everybody to be able to go to their nearest barangay, to their community, to a clinic, and to be able to talk about a problem that they might have, to discover a problem that they didn't know they had, to be able to process feelings that they had that might actually lead to a serious mental condition. We're thinking and talking about the people that we see on a day-to-day basis, the people that we see on the streets roaming around, sleeping in cartons, sleeping under the bridge, people that we are scared of or scared to approach. These are the kinds of people that we have in mind. The most needy Filipinos who have no access to help when it comes to their mental wellness. And community-based service, community-based healthcare is the answer to such problems. Madam Speaker, it also stresses the fact that treatment for mental health conditions involve not only the patient or the client or the service user, but it has to also involve the families and their communities. They cannot be isolated or singled out, and it is best for them to be left in their communities and treated where they are most comfortable in order for the treatment to be effective. And that, again, is another highlight of community-based healthcare. It is enumerated, and the provisions in Section 21 of the bill talks about the importance of capacitating the barangay health workers to be able to address the needs of all Filipinos, to be able to provide health care, mental health care as part of primary health care. And that is going to be one of the priorities with the Comprehensive Mental Health Act, to be able to allow our barangay health workers to become the first responders, or to be able to provide mental health first aid. Mr. Speaker, Madam Speaker.
Thank you for those relevant answers, distinguished sponsor. But my question really was, is there a transition from hospital-based to community-based mental health care system, which is articulated in the provisions of this bill?
Madam Speaker, precisely that. Going down to the barangays and capacitating and enabling the barangay health workers who are not necessarily psychiatrists, psychologists, which number very few in our country today, allowing them to be able to address or at least recognize mental health problems is a first step towards this direction. This is non-existent at the moment, or this is not the common practice as of yet. But we recognize how important it is to be able to help all those in need, even at the barangay and the community level. Part of this also, Madam Speaker, is the availability of medicines, free medicines for the indigent, for those who need, and also the acknowledging that not all problems with mental health, or not all seeming problems with a mental condition, will lead to hospitalization or to a clinical approach. And this will ease the burden as well of the mental health facilities, very few that we have in the country today. And it will recognize also that we should be able to attain an overall healthy citizenry by just starting with the communities and just being able to deal with mental health on a primary health level, Madam Speaker.
May we know, distinguished sponsor, whether there are existing viable community-based mental health care facilities in various areas nationwide?
Right now, Madam Speaker, there is already a, if I'm not mistaken, it has already been launched, but there are pilot areas and programs. Quezon, I believe, is one. The Surigao del Sur pilot project launched by the DOH will also include this mental health program involving the communities. This is something that is espoused by the Secretary of Health as was observed in Cuba, for example. It is not yet widespread, and we are counting on this bill, the passage of this bill, to be able to help this effort and to fast-track it, Madam Speaker, and that's the importance of passing this measure at the speediest time.
Are there community-based mental health care facilities in the city of Manila, for example, in Quezon City, Makati City, Antipolo City, Cebu City, Davao City, Iloilo City, Baguio City, and other important places in the country?
Right now, I can speak for my district, Madam Speaker. We are pushing for a community-based mental health facility in Antipolo. We recognize the need for it and recognize the need for it elsewhere in the country. And again, this emphasizes the importance of the passage of this bill, Madam Speaker.
So, from the answer of the distinguished sponsor, there are only pilot areas and there are no sufficient community-based mental health care facilities presently. Then how will this bill enable the establishment of such facilities?
Let me just mention that there is an existing program or facility in Quezon City. There is a program for mental health. I think it is the intention of the Department of Health, aside from observing best practices elsewhere in the world, as they have, but starting with these pilot programs in chosen areas in the country. I think this is the direction that the Department of Health wants to go. And again, this just underscores the importance, really, of supporting this measure. As we said, it's been 30 years since legislation for this measure has been attempted. There has been trials and failures for the past 30 years. And what the Honorable Lagman is bringing to light just, again, emphasizes the need for us to fully support this measure and to implement community-based treatment for mental health conditions all over the country.
Well, my question really was whether there are pertinent provisions in the bill, not general provisions, but specific provisions which would enable the establishment and operation of community-based mental health care facilities nationwide.
Like I mentioned, Madam Speaker, we will start with the enabling the barangay health workers. That is really the first line of defense, if we can call it that. The idea being they should be able to meet their constituents or those in their area to be able to assess them for primary care, to provide them primary care, but at the same time assess them for their overall mental well-being. And barangay healthcare workers will be capacitated or will be enabled to assess whether or not there needs to be further action, if they need to be referred to professionals, or sometimes all they need is to be told that there is something to be done, to be listened to be empowered, and to be educated about what is there for them. And that is the priority of this particular program, Madam Speaker. Let me go to Section 21 of our bill, which reads, mental health services shall within the general health care system in the community include development and integration of mental health care at the primary health care in the community, support services for families and co-workers of service users, carers, legal representatives, and mental health professionals, community resilience and psychosocial well-being training in all barangays, including the availability of mental health and psychosocial support services for issues related to everyday living, for example, parenting and marriage, and related to natural disasters and other calamities. This is something that we also need to stress, Madam Speaker, because as we know, our country has gone through a lot of natural calamities of late, and the emphasis on post-traumatic stress disorder treatment cannot be made louder. This is really something that we need to focus our energies on, and this is something that is highlighted in our bill. And finally, like I mentioned, the training and capacity building programs for local mental health workers so that they can undertake mental health care in the community in coordination, of course, with mental health facilities and with the departments of psychiatry and neurosciences in general, and university hospitals in the academe or relevant specialty and organizations. This is a community effort as much as it is a community service, Madam Speaker. This requires the efforts of the entire mental health community to be able to see this work and to be able to see their goals come to fruition, Madam Speaker.
Well, to be more specific, Madam Speaker, distinguished sponsor, what specifically are the equipment and personnel requirements for a community-based mental health care facility?
It will start with thorough and meaningful and tested and, I guess, recognized training coming from, there are many different programs that are available. We know a program such as mental health first aid that is employed in Australia, originated in Australia, used in about 10 different countries in Asia, including Japan, Nepal, of course. It's also used in the UK and the US. Programs such as these, not necessarily that one in particular, but programs involving the training, thorough training of the barangay health workers by the psychiatrists and the psychologists, and those who will enable them to be able to stand as first responders to mental health concerns. There are modules that we will abide by. There are strict programs that are out there that will be, the devices that will be used by the DOH to properly train these barangay health workers.
Well, from the answer of the distinguished sponsor, among others, what would be needed would be train professionals on the delivery of mental health care services, like psychiatrists, psychologists, and other allied professionals. Do we have presently an adequate pool of such qualified professionals?
We are talking about the mental health workers, nurses, primary physicians, all trained through World Health Organization.
Psychiatrists?
Yes. When asked the question of the Honorable Lagman, it is well known that there is a dearth of psychiatrists in this country. I think the number to 500 or 550, not very many at all. It is alarming, the ratio of psychiatrists, practitioners, specialists in this field, the ratio of these specialists to those who need their services. I've read statistics that say there is one for every 130,000 Filipinos, one psychiatrist for every 130,000 Filipinos. And this problem is also being addressed by the Comprehensive Mental Health Act. We are trying to improve and to increase the number of practitioners by mandating that psychiatry, neurology, and subjects such as these be mandatory in the tertiary level. And even in the primary and secondary level, subjects on mental health should already be introduced. But taking into consideration the situation at hand, where we have very little psychiatrists in the country, this bill also recognizes the importance of the practicing psychologists who are able to also help those who need, whose needs need to be addressed. And again, the importance of capacitating volunteers, community workers, and other laymen, anybody should be able to, with enough training, with commitment, to be able to be first responders, to be able to help in improving the situation or the state of mental health of the country. Just to be specific, DOH provided us the number. There are currently 539 diplomat psychiatrists in the country. And just from the numbers, we know that they need to really be increased. And again, the effort to try to involve the entire community of mental health practitioners to be able to address the state of mental health of the country today, Madam Speaker.
Well, admittedly, there is really a dearth of psychiatrists and other professionals on the delivery of mental health care. With about 500 psychiatrists nationwide for a population of 105 million people, that's extremely a very low percentage. Now, is there a specific provision in the bill which would encourage the entry of more psychiatrists, psychologists, and other health professionals on the delivery of mental health care?
Madam Speaker, aside from including these subjects, as we mentioned, in the tertiary level, there is also the acknowledging the fact that psychiatrists in the past were probably also discouraged from pursuing that particular specialization because of the lack of emphasis and lack of support, lack of laws, legislation that protect and support their field. And I'm hoping, and we are hoping, that the passage of this bill will also encourage more physicians to pursue this field. Let me just make mention, Madam Speaker, of the National Program for Mental Health from 2017 to 2022. This is an entire strategic plan that has already been drawn out by the Department of Health. And it also includes the financial capability of Department of Health to capacitate and train the workers, the different community workers that we are looking to service the community-based programs and facilities. And it is also worth mentioning, Madam Speaker, that no less than the World Health Organization explains that there is perhaps a mistaken notion that improvements in mental health require sophisticated and expensive technology and the services of psychiatrists and psychologists, highly specialized staff. The reality is that most of the mental health issues that face our population today can be managed by non-specialists, by those who serve in the community-based facilities, Madam Speaker.
Would the distinguished sponsor be amenable to an amendment which would provide for a specific policy to encourage the study and entry of professionals in the delivery of mental health care services, like provision for incentives and a scholarship program?
Madam Speaker, that is already part and parcel of the National Mental Health Program Strategic Plan for 2017 to 2022, which the DOH intends to adhere to, and this is going to be the basis of the mental health program as prescribed in the Comprehensive Mental Health Act. And we are happy to note that this is something that is already included in this program. And again, in many other parts of the bill, I think it will be most encouraging for physicians to see that mental health is given priority in the country, and therefore it would be advantageous for them to actually pursue that line of specialization.
May we know what specific provision is there with respect to the grant of incentives and a scholarship for those who would like to pursue a study and practice in the delivery of mental health care services?
For one, Madam Speaker, there is a provision for plantilla positions on the local level, and that in itself should encourage particularly the new doctors to pursue this specialization.
Well, a plantilla position would mean that there is an existing qualified professional. But the purpose really of the question is whether there are incentives and scholarship grants so that we could encourage more to study the course on mental health.
Yes.
And then practice the same.
Madam Speaker, the National Center for Mental Health in Mandaluyong is actually not just a hospital, but also a facility where physicians can be trained as a psychiatrist. And with this program, physicians who are not currently practicing within this field can pursue further education, and this will be provided for by the government to allow them to be able to specialize in the fields of psychiatry.
I would like to see the specific program, because in the absence of such a specific program, then this bill can be the avenue for giving incentives as well as scholarship, even for postgraduate studies, for those who are interested to pursue the profession on mental health care service.
Madam Speaker, because this is part of the intention of this bill, as we recognize that it really is a problem, the dearth of the number of psychiatrists in the country. And we are confident that this bill will address that problem, but with the help of the Honorable Lagman, perhaps in rephrasing some of the provisions of the bill so that they would more directly address this particular issue of allowing current physicians to practice in psychiatry and encourage the upcoming medical professionals to actually go into that field, then we are amenable.
Thank you, distinguished sponsor, because an intention should be articulated. And the best articulation would be a specific provision in this bill. Now, what is the approximate minimum budgetary requirement for the establishment and operation of a community-based mental health care facility?
Before we go into the specifics, Madam Chair, we just would like to mention the budget allocation for mental health Historically, the Department of Health has been giving a good amount of their budget for mental health programs even before the creation of this bill. In 2017, 5.8 billion was allocated for mental health. And as far as the capacity building and the enabling of community health based programs, the DOH is still not able to pinpoint an exact figure, but we trust that it is well included in their budget for 2018.
Well, I'm not sure of that. Whether the establishment and operation of community-based mental health care facilities are included in the present budget or in the proposed budget of the Department of Health.
One
That's
thing to
why
consi-
I am asking the question, how much is the minimum budgetary requirement for the establishment and operation of a community-based mental health care facility?
One thing to consider, Madam Speaker, capacitating the barangay health workers who are already existing in their communities is a cost-effective way of making the community-based, manning these community-based facilities, because we are using the same barangay health workers who go around providing primary health care already. I think that is the idea as well. It is just additional training for them. And this should also, I guess it will become a cost-saving measure, I guess, for all of us, because the barangay health workers are already there. They are already tasked to provide primary care to their communities, and what we want to do is just to further capacitate them to provide mental health care as well.
Well, the capacitation of barangay health workers is a good starting point. But we all know that in a community-based mental health care facility, there are other personnel which should be included. For example, the professional mental health care providers, and also the necessary equipment, plus the required medicines. So most probably we should ask the Department of Health to give us an estimate of how much would be needed for budgetary support for the establishment and operation of a community-based mental health care facility. I am certain that they must have the figures, and they should provide the same to the House of Representatives so that we could fully effectuate the enactment of this bill.
It's worth noting, Madam Speaker, that mental health programs are already included and aggregated in the different budgets or in the different programs that the DOH has. It's just that it hasn't been identified as a budget for community-based facilities per se. But we are confident that these community-based facilities are already incorporated in all of the plans that the Department of Health has for their different programs in the different communities.
Yeah, but since we are emphasizing the establishment and operation of community-based mental health care facilities, then I suppose it would be wise for the Department of Health to disaggregate the minimum budgetary amount needed for the establishment of a community-based mental health care facility for the guidance of legislators who are going to enact this bill.
Madam Speaker, let's look, for example, at the budget allocation for the existing mental health programs of the DOH in the past couple of years. While we know that mental health programs are included, in particular in 2016, 8.3 million was allocated for mental health programs in the in the two main mental centers, mental hospitals, and we also have budget allocations for psychiatric facilities, operation expenses for operation of the dangerous drug abuse centers, etc. These are all indications that mental health services are already incorporated within the budget of the DOH, but we do acknowledge and recognize the need, as the Honorable Lagman has brought up, to see exactly what it will cost to create something that is still not yet in existence. This is something that we are doing from scratch, and I guess it would be beneficial to all to see how much exactly.
Yeah.
Although I don't know if it is possible to come up with an exact budget for every community, given that each community is made up of different factors.
It is an approximation of the average budgetary requirement. And I think it will not be difficult for the sponsoring committee to ask the Department of Health to disaggregate that portion which would be for the creation and operation of community-based mental health care facilities.
Well noted, Madam Speaker, and we will ask the DOH to do the same.
Last question on this topic, Madam Speaker, distinguished sponsor. Is the definition of a community-based rehabilitation under Section 4D adequate to properly convey the concept and emphasis on a community-based mental health care facility? Or would it require some more improvement and amendment to capture the very importance of this transition to a community-based mental health care facility?
Let me read the definition that we have on Section 4D. Community-based rehabilitation refers to a rights-based program planned and implemented in the community that ensures intervention for a mental health patient, either as a supplemental undertaking to hospital care, primary drug use programs, or in place of facility-based treatment, as long as the patient is not a danger to oneself or to others. This, Madam Speaker, is the definition as provided in Section 4 of our bill, but there is also a Section 12, that provides for all of the duties and responsibilities of all mental health facilities and mental health service providers, and this includes the community facilities as well. So we feel that this bill adequately provides for all of the, example, or it includes and is specific to the importance of community-based healthcare, Madam Speaker.
Well, thank you, distinguished sponsor, for saying that this definition is adequate. And most probably, at the proper time, we may introduce some perfecting amendments to this definition, but that would have to come later. Now, I will go to my next topic on the types, classifications of specific mental illness or disorder. I notice, distinguished sponsor, that the bill mentions about mental health or disorder in a generic language. However, there are various types and classifications of mental illness or disorder which should be identified in the bill for proper appreciation and disclosure. Does the sponsor agree that such identification and disclosure be made instead of hiding these specific mental illnesses or disorders in generic terms?
Madam Speaker, I think we are counting on the professional community to be able to fully define the disorders that are included in this bill, which includes all the psychiatric disorders and psychosis that there are. It might be futile to have to mention every single one as there are so many, but there is a book such as the DSMR and other references that will list all of the different disorders that would fall under psychiatric disorders, which is mentioned in the bill. This would include the more commonly known disorders such as schizophrenia and bipolar disorder, multiple personality disorder, and many, many more, Madam Speaker. And it probably would not be possible to mention all of the disorders in the bill, but to say that it will include all psychiatric disorders should be sufficient. It will also include all disorders such as major depression and anxiety disorders such as panic disorder, obsessive compulsive disorder, phobia, post-traumatic stress disorder, anorexia and bulimia, impulse disorders like kleptomania and the like. Again, the list is endless. There are many, many other disorders that fall under anxiety disorders, but this bill includes all the disorders that fall under this particular category.
Yeah.
We include all neurologic disorders, the most commonly known of which are dementia, Alzheimer's, Parkinson's disease, epilepsy, narcolepsy, also IDD or intellectual developmental disorders such as dyslexia, ADHD, autism, Down syndrome. And we also include addiction or substance use disorders such as gambling, alcohol, substance abuse, shopping disorders, even hypersexual disorders, internet disorders, the list goes on, and more are discovered as we go along. And we believe mentioning in the bill all of the general classifications of all of these known, or all of these psychiatric disorders, neurologic, mental, and substance disorders should suffice, Madam Speaker, because the intention is to include all those who need help when it comes to achieving their mental health.
Madam Speaker, distinguished sponsor, we are not calling for an exhaustive enumeration of all kinds of mental illness. We're only asking for a specification of the major ones for the appreciation of this chamber as well as of the community. To destigmatize mental illness, we should be open to talking about it in plain, neutral language. And this includes calling the illnesses by their actual names and not using euphemisms. So, to my mind, we could include the following enumeration, which is not all-inclusive: anxiety disorders, mood disorders, and this would include depression and bipolar disorder, schizophrenia, psychotic disorders, dementias, eating disorders, postpartum depression, and post-traumatic stress disorder, or PTSD. I don't think it would harm the bill if we make this disclosure of some of the more important mental illness, rather than treat them in a generic language. So at the proper time, I would propose that these major classifications should be included in the bill.
Madam Speaker, I think we were able to highlight the most common and the most well-known of these disorders, and perhaps to mention the major categories and classifications such as psychiatric or psychosis, major depression, anxiety, neurologic disorders, and to give the examples of the most well-known disorders such as dementia, Alzheimer's, Parkinson's, and those that both the Honorable Lagman and this representation has mentioned, I think should suffice. And just to note, Madam Speaker, there's also the concern that the terms used are always updating. Using the general terms will also prevent the bill from being outdated in light of the ever-changing terms and the newly discovered disorders. Case in point, what used to be known as bipolar, what is known now as bipolar disorder, used to be called manic depressive psychosis. That is just one example. But this is also to safeguard or to to ensure that our bill will not be outdated. Having said that, the inclusion of perhaps the mention of the major well-known disorders as enumerated by the Honorable Lagman is well noted.
Thank you, distinguished sponsor. Now, talking about this depression and bipolar disorder, I think we should be able to give a human face to this common mental ailment. Persons with bipolar disorder and episodes of depression should never be demeaned, humiliated, or disgraced, as cogently proposed in the bill. Many of these people have contributed much to history and culture, like the following. Literary figures like Edgar Allan Poe, Ernest Hemingway, Tennessee Williams, Virginia Woolf, and Leo Tolstoy. Actors and actresses and singers like Frank Sinatra, Catherine Zeta-Jones, Richard Dreyfuss, Patty Duke, Reuben Williams, Carrie Fisher, Francis Ford Coppola, director, Elton John, and Brooke Shields and Mary Osmond, who suffered postpartum disorder. World leaders like Napoleon Bonaparte, Adolf Hitler, even Winston Churchill, General George S. Patton Jr., Jesse Jackson Jr., Abraham Lincoln, Ted Turner, the founder of CNN, and sports personalities like Mike Tyson, Ricky Hatton, David Beckham, and Marty Fish of tennis. Madam Speaker, distinguished sponsor, this is the reason why this bill should be appreciated. Because it would discourage the humiliation or disgrace people like all of those who I have enumerated who had polar and depression, bipolar and depression disorder. And for purposes of this discussion, I think at another time, most probably, we will have to categorize and specify the very mental ailment of these popular figures. I am not mentioning here local personalities, but I am certain that there are many local personalities in the category of Edgar Allan Poe, Ernest Hemingway, Napoleon Bonaparte, and other sports personalities. Now, let me go to my third topic, and this will be the coverage of private hospitals. Does this bill include or cover private hospitals, distinguished sponsor?
Madam Speaker, the bill includes all hospitals, private and government.
Beg your pardon?
Yes, Madam Speaker, private hospitals need to abide by all of the provisions of this law as much as the government and public hospitals and facilities.
Yeah. Okay. I am happy to note that. But most probably, there should be a specification in the bill with respect to the coverage of private hospitals.
Madam Speaker.
Yes.
Madam Speaker, let me again refer to Section 12 of the bill. Duties and responsibilities of all mental health facilities and mental health service providers. It lists 8 provisions. I can read them here, but the point is all of these responsibilities of all mental health facilities and mental health service providers include the private hospitals as well. There aren't very many in the country, which again highlights the need for us to be able to provide the help and treatment to those who cannot afford private hospital care. But having said that, all of these provisions apply to all mental health facilities, including private hospitals. If it is the pleasure of the Honorable Lagman, we can mention private hospitals.
Yes.
And just
Well, because the provision you have read, distinguished sponsor, would refer to professional doctors, psychiatrists, etc. But they do not refer specifically to private hospitals. Because, for example, in Section 18 provides, and I quote, all regional, provincial, and tertiary hospitals shall provide the following: psychiatric, psychosocial, neurologic services. Then I understand that regional and provincial hospitals refer exclusively to government-owned and operated hospitals. Is that correct?
That's correct, Madam Speaker. Section 18 is inclusive, falls under Chapter 5, which talks about mental health service in the community. And that is why it enumerates the provincial and the regional and tertiary hospitals per se. But again, I don't believe it supersedes the provisions of Section 12, whereby all mental health facilities, which includes private facilities, need to abide by the provisions as stated here. So we believe it still covers the private hospitals, Madam Speaker.
Since we are now legislating, I think we should not base on assumptions, but we will have to be very specific so that there will be no questions later as to the intention of the Congress.
If it is the pleasure of the Honorable Lagman, again, maybe we can just include the term private hospitals in Section 18 after tertiary hospitals.
Yeah, because the
be
tertiary
thorough.
hospital would also be referring to government hospitals. Well, there is a precedent, Madam Speaker, distinguished sponsor, when a bill which is now an act covered private hospitals. And this is Republic Act number 10354, the Reproductive Health Law, under Section 7 of the Act, which covers private hospitals rendering services to paying patients. With the option to establish charity ward. So, under this precedent, we will be proposing an amendment at the proper time.
Noted, Madam Speaker.
Now, let me now go to my fourth subject, which is the Philippine Mental Health Council. As mentioned in Section 14 of the bill, the Philippine Council for Mental Health was created under Executive Order number 470, issued by President Fidel Ramos on February 24, 1998. Unfortunately, I don't think this council was ever operationalized. And as of today, this council has no specific budget. Is that correct?
That's correct, Madam Speaker. It was passed under the administration of President Fidel Ramos. It was the executive order was never actualized, Madam Speaker. But may I mention that it is also the inspiration, if I may say, or this is the basis by which we are putting together this Comprehensive Mental Act and the creation of a Philippine Mental Health Council that is better supported financially and otherwise, and with much consideration of the needs and the desires of the community. There was a lot of consultation that went on with the psychiatric organizations of psychiatrists, psychologists, and other practitioners in the field. So we are hoping that the current model of the Philippine Council for Mental Health will be implemented and will be able to serve the mental health community as it was intended.
We fully appreciate, Madam Speaker, distinguished sponsor, the reconstitution and the operation of this Philippine Council for Mental Health. But there are some questions I would like to propound. You would recall, distinguished sponsor, that under Section 1 of Executive Order 470, the composition of the Council was provided with the Secretary of Health as chairperson and the following as members: Secretary, Department of Social Welfare and Development; Secretary of the Department of Education, Culture and Sports, now the Department of Education; Secretary of the Department of Justice; Secretary, Department of Labor and Employment; Secretary, Department of the Interior and Local Government; Medical Center Chief, National Center for Mental Health; Chairman, Department of Psychiatry, UPPGH; Chairman, Commission on Higher Education; Director General, Technical Education and Skills Development Authority; and 3 representatives from the non-government organization concerned with mental health to be appointed by the chairman of the council. May we know, distinguished sponsor, why the foregoing composition was not maintained in the bill?
Again, this is part of the Mental Health Council that was enacted as a EO back in 2010. And for many other reasons, this council did not see the light of day. But what the intention is with this bill is to bring back the Philippine Council for Mental Health, again, with more teeth, with a proper budget, and to be able to accomplish everything that the president, the EO, set out to do, and more. So we are looking to fulfill the composition of the council as inspired by the EO 470 that we just read.
Well, most probably the intention why the composition was not maintained was because some sectors are asking that an independent, autonomous, and highly competent membership of the Philippine Mental Health Council is envisioned to be the venue for the need to inspire and engender more involvement from the private sector, harness their experience, skills, and commitment towards a more mentally healthy nation. Would the distinguished sponsor confirm that this is the reason why the composition was not maintained, because we want an independent and autonomous and competent PMHC?
Yes, Madam Speaker. The original EO included 3 representatives from the non-government organizations concerned with mental health to be appointed by the chairman of the council. And just as the Honorable Lagman pointed out, we probably need more participation from the non-government organizations and other members of the mental health community. There is a proposed alternative composition to the council, which includes the Secretary of Health as ex officio chairman, the Executive Director as vice chairman and chief executive officer, 2 representatives from the government sector, 2 representatives from the private health sector or consumer groups, 1 representative from the academe or research, 2 representatives from the professional organization, and 2 representatives from the allied non-government organizations involved in mental health issues as members. And we are more than willing to adopt this particular composition to satisfy the inquiry of the Honorable Lagman. And it will be part of the committee amendments.
I suppose the bill must state the composition of the council, because otherwise, if the Secretary of Health will be the one to determine the composition after consultation with public and private stakeholders, as provided for in Section 14, there might be a constitutional infirmity.
Yes, Madam Speaker, we will include this and specify it as part of the amendments, where the Secretary of Health is an ex officio chairman but not the sole personality to name the members of the council.
Yeah. I have here a suggestion from a recognized leader in the field of mental health care. And the composition would be as follows: Chair, Secretary of Health. Members, Government Sector, Secretaries of DSWD, Department of Education, and D&D. Non-government and academe, Philippine Psychiatric Association, World Association for Psychosocial Rehabilitation, Psychological Association of the Philippines, Philippine Mental Health Association, Department of Psychiatry of a medical school. Then another group would be user group and advocates like families, ex-patients, sympathetic media practitioner as advocate. Most probably, the sponsoring committee could harmonize these proposals and find out the best composition of the council. But the purpose is to make it independent and autonomous.
Well noted, Madam Speaker.
Thank you, Madam Speaker. Well, I have other questions, but Madam Speaker, distinguished sponsor, I had a bilateral knee joint replacement simultaneously, and I could not stand for more than an hour. So this is some physical disability, not a mental disability. I'm sure of that. So I would request that I suspend my interpellation for tomorrow, and I will wrap up my interpellation by tomorrow, Madam Speaker.
Majority Leader.
Madam Speaker, I move that we recognize the Honorable Deputy Speaker Pia Cayetano for her interpellation.
Honorable Deputy Speaker Pia Cayetano, you have the floor.
Thank you, Madam Speaker. I'm actually a co-author, so it's more of a manifestation. I'd just like to put on record, I worked on this in the Senate for about 4 years, and I'd like to point out a certain section under Basic Mental Health Rights. Section 6, letter G, refers to every person with a mental illness right to access to treatment which address holistically their needs through a multidisciplinary care plan approach. I'd like to emphasize, Madam Speaker, that this is very critical because we read a lot of studies, especially in countries where they have, I guess, stronger mental health programs, that the access to medicine makes it easier for doctors to prescribe these kind of mental health medicines. And over the years, the decades actually, there's been a lot of studies that there have been overprescriptions, even with children, on mental health cases, and they were given very strong medicines to deal with depression, etc. I'm not a health professional in any way. I am a health advocate, and I just want to put on record that my support of this bill that has been, as I said, that I had filed even in the Senate, remains. However, I want to emphasize that multidisciplinary approach. And just to put on record one study that I've read repeatedly and repeatedly, when they did a test on people with depression, one test group were given antidepressant medicines. Another test group was just told to embark on a running program, and a third test group was told to do nothing. Guess which group came out with the best results? It's those that were given a running program, not medicines. That is why I emphasize this multidisciplinary care plan approach, which is holistic in nature and not just veering towards medication. That's all, Madam President. Thank you, Madam Sponsor.
Majority Leader.
Thank you. I'd just like to take the opportunity to thank the Honorable Pia Cayetano for her full support. Like I said, on a personal note, I think it was she here in Congress who I first approached about my pet bill, and I'm happy to, and I think we are both overjoyed to see this bill where it is now. Thank you.
Majority Leader.
Madam Speaker, I respectfully move to suspend consideration of House Bill number 6452. So move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I respectfully move that we suspend session. So move, Madam Speaker.
No objection. The chair hears none. we suspend for a few minutes. Magaling. Session is resumed. The majority leader is recognized.
Madam Speaker, I move that we suspend consideration of House Bill 6452.
Is there any objection? The chair hears none. The motion is approved.
Before we proceed, Madam Speaker, may we greet the guests of the gentleman, or our Assistant Majority Floor Leader, Jose Enrique Garcia III. This is a delegation of officials and members of the Balanga City Lions Club, headed by Councilor Liza Vasquez and Dr. Owen Gloria.
Please stand. Welcome to the House of Representatives.
Madam Speaker, I move that we take up items in our calendar of business.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we take up on second reading House Bill number 1530, contained in Committee Report 397, and upon motion approved, please direct our Secretary General to read the title of the measure.
Secretary General is directed to read the title of 1530.
House Bill number 1530, an act requiring government agencies to indicate the blood type of individuals in the identification cards, certificates, and licenses.
Madam
Majority
Speaker,
Leader.
to sponsor the measure, I move that we recognize the distinguished chairperson of the Committee on Health, the lady from the 4th District of Quezon, the Honorable Angelina Tan.
The chairperson of the Committee on Health, Honorable Helen Tan, is recognized.
Thank you, Madam Speaker. The Committee on Health is submitting House Bill 1530, entitled An Act Requiring Government Agencies to Indicate the Blood Type of Individuals in the Identification Cards, Certificates, and Licenses. Please let the explanatory note of the author, Representative Alexandria Gonzalez, be adopted as our sponsorship speech.
Majority Leader.
With that, Madam Speaker, I move that we consider the explanatory note of the measure as the sponsorship speech.
Is there any objection? The chair hears none. The motion is approved.
Since there are no interpellators, Madam Speaker, before that, Madam Speaker, since there are no interpellators, Madam Speaker, I move that we close the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we open the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Since there are no amendments, Madam Speaker, I move that we close the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we approve on second reading House Bill number 1530.
All those in favor, please say aye. All those against, please say nay. The ayes have it. House Bill 1530 is approved on second reading. Majority Leader.
Madam Speaker, I move that we consider on second reading House Bill number 6396, contained in Committee Report 380, and upon motion approved, please direct the Secretary General to read the title of the measure.
The Secretary General is directed to read House Bill 6396.
House Bill number 6396, an act instituting policies for the protection and welfare of caregivers and the practice of their profession.
Before we proceed, Madam Speaker, I move that we include the following members as co-authors of this measure. First, Representatives Rodolfo C. Fariñas, Juan Pablo Bondoc, Arthur Defensor Jr., Roger Mercado, Dulce Ann Hofer, Vincent Crisologo, Aurelio Gonzalez Jr., Victoria Isabel Noel, Arnel T., Alexandria Gonzalez, Johnny Pimentel, Francisco Matugas II, Marlene B. Alonte, Deogracias Victor Savellano, Oscar Garin Jr., Benhur Lopez Jr., Vini Nola Ortega, Jose Enrique Garcia III, Jericho Jonas Nograles, Ron Salo, Bernadette Herrera D., Maria Cristina Puno, Marlene Primicias Agabas, Jose Atienza Jr., Eugene Michael De Vera, Anthony Bravo, Luis Angel Campos Jr., Harlene Neil Abayon III, Mylene Garcia Albano, Frederick Abueg, Randolph Ting, Geraldine Roman, Cesar Sarmiento, Francis Gerald Abaya, Franz Alvarez, Celso Lobregat, Henry Waminal, Angelina Tan, Rodolfo Albano III, Dakila Carlo Cua, Robert Ace Barbers, Ramon Durano VI, Edgar Mary Sarmiento. I so move, Madam Speaker.
Any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we open the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, to sponsor the measure, I move that we recognize the distinguished chairperson of the Committee on Labor, the gentleman from the 3rd District of Cagayan, the Honorable Randolph S. Ting.
The Honorable Ting is recognized.
Thank you, Madam Speaker. I have the honor to present Committee Report number 380 on House Bill number 6396, an act instituting policies for the protection and welfare of caregivers in the practice of their profession. May I request that the explanatory notes of the Honorable Geraldine Roman be the sponsorship speech, Madam Speaker. Thank you.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, since there are no interpellators, I move that we close the period of sponsorship and debate.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, I move that we open the period of amendments.
Any objections? The chair hears none. The motion is approved.
Since there are no amendments, Madam Speaker, I move that we close the period of amendments.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, I move that we approve on second reading House Bill number 6396.
As many as are in favor, please say aye. Aye. As many as against, please say nay. The ayes have it. House Bill number 6396 is approved on second reading. Majority Leader.
Madam Speaker, I move that we consider on second reading House Bill number 6425 contained in Committee Report 389, and upon motion approved, please direct the Secretary General to read the title of the measure.
The Secretary General is requested or directed to read the title of House Bill 6425.
House Bill number 6425, an act prescribing an urgent, comprehensive, and integrated land-based traffic management policy to effectively address the traffic congestion crisis in Metro Manila, Metropolitan Cebu, and Metropolitan Davao, and appropriating funds therefore.
Majority Leader.
Madam Speaker, I move for suspension.
Session is suspended.
Consider na lang natin na explanatory.
Wala tayong sponsor. So time out
Mababa
tayo.
daw, pero nagsasabi nga na bukas na.
Session is resumed. The majority leader is recognized.
Madam Speaker, I move that we suspend consideration of House Bill number 6425.
Any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we take up business for Thursday and Friday.
Any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we consider the omnibus approval on second reading of the following House bills as contained in the respective committee reports. House Bill number 6431 in 391, House Bill 6449 in Committee Report 392, House Bill number 927 in Committee Report 394, House Bill number 6465 in Committee Report 395, House Bill number 3932 in Committee Report 396, House Bill number 6512 in Committee Report 400, House Bill number 6513 in Committee Report 4001, House Bill number 6521 in Committee Report 403, House Bill number 6522 in Committee Report 404.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, I move that we open the period of sponsorship and debate for these measures.
Any objections? The chair hears none. The motion is approved.
And for these measures, Madam Speaker, I move that we consider the respective explanatory notes as the sponsorship.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, since there are no interpellations on these measures, I move that we close the period of sponsorship and debate.
Any objections? The chair hears none. The period of sponsorship and debate is terminated.
Madam Speaker, I move that we open the period of amendments.
Any objections? The chair hears none. The motion is approved.
Since there are no amendments, Madam Speaker, I move that we close the period of amendments.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, I move that we approve on second reading House Bill numbers 6431, 6449, 927, 6465, 3932, 6512, 6513, 6521, 65 and 6522. I so move, Madam Speaker.
As many as those in favor, please say aye. As many as those against, please say nay. The ayes have it. The four bills, the aforementioned bills, are approved on second reading.
Madam Speaker, I move that we take up reference of business and bills on first reading. And upon motion approved, please direct our Secretary General to read the numbers and titles of the measures.
The Secretary General is directed to read the titles of the House bills.
Reference of business bills on first reading. House Bill 6478 mandating the secretaries of the DOF, NEDA, and DBM and the governor of the BSP to appeal biannually before a joint congressional oversight committee to report on the status and directions of the fiscal and monetary policies of the state. Representative Gatchalian.
To the Committee on Appropriations.
House Bill 6479 establishing a Quezon Coconut Research and Development Center. Representative Suarez.
To the Committee on Agriculture and Food.
House Bill 6480 regulating the practice of speech-language pathology. Representative Antonio.
To the Committee on Civil Service and Professional Regulation.
House Bill 6481 declaring Mount 387 in Caranglan, Nueva Ecija as tourist destination. Representative Villago.
To the Committee on Tourism.
House Bill numbers 6482, 6483, and 6484 establishing various national high schools and certain barangays in Southern Leyte. Representative Mercado.
To the Committee on Basic Education and Culture.
House Bill numbers 6485 and 6486 establishing regional trial courts in Southern Leyte. Representative Mercado.
To the Committee on Justice.
House Bill number 6487 establishing a fish breeding farming research center in Bontoc, Southern Leyte. Representative Mercado.
To the Committee on Aquaculture and Fisheries Resources.
House Bill number 6488 to 6490, establishing multi-species marine hatcheries in certain municipalities in Albay, Representative Gonzales.
To the Committee on Aquaculture and Fisheries Resources.
House Bill 6491, declaring as agricultural land portions of forest land located in Malay, Aklan, Representatives Marquez and Agabao.
To the Committee on Natural Resources.
House Bill 6492, extending to 5 years the validity of the professional identification card, Representative C. Alvarado.
To the Committee on Civil Service and Professional Regulation.
House Bill 6493, providing for a 20% discount privilege on the sale of goods and services for active members of the AFP and PNP, Representative C. Alvarado.
To the Committee on National Defense and Security.
House Bill number 6494 to 6499, providing for the establishment of DESTA training and accreditation centers in certain cities and municipalities in Bulacan, Representative C. Alvarado.
To the Committee on Higher and Technical Education.
House Bill 6500, extending the paternity leave from 7 to 15 days, Representative C. Alvarado.
To the Committee on Labor and Employment and the Committee on Civil Service and Professional Regulation.
House Bill number 6501, creating in the DepEd the plantilla positions of guidance counselors, Representatives Tino and Castro, France.
To the Committee on Appropriations.
House Bill 6502, establishing a brackish water multi-species breeding farm and hatchery in Lala de Rote, Representative Maporo Abdullah.
To the Committee on Aquaculture and Fisheries Resources.
Resolutions. House Resolution 1346, extending profound condolences on the demise of Engineer David N. Kumsunhi, Representative Nieto.
To the Committee on Rules.
House Resolution 1347, expressing profound condolences on the demise of Mario A. Hernando, Representative Nieto.
To the Committee on Rules.
House Resolution 1348, direct the Committee on Human Rights to investigate the July 16 EJK of Silvestre Maratas, Representatives Casilao, De Jesus, Tino, and several others.
To the Committee on Rules.
House Resolution 1349, directing the Committee on Human Rights to investigate the EJK of Militon Katampongan, Representatives Casilao, De Jesus, and several others.
To the Committee on Rules.
House Resolution 1350, direct the Committee on Human Rights to investigate the September 5 EJK of Lumad student Obelio Bayao, Representatives Casilao, De Jesus, and several others.
To the Committee on Rules.
House Resolution 1351, directing the Committee on Human Rights to investigate the September 2 EJK of farmer couple Jestril and Dalia Arabis, Representatives Casilao, De Jesus, and several others.
To the Committee on Rules.
House Resolution 1352, direct the Committee on Human Rights to investigate the August 20 prostrated EJK against Roy Ibarat, Representatives Casilao, De Jesus, and several others.
To the Committee on Rules.
House Resolution 1353, respectfully urging His Excellency President Rodrigo R. Duterte to nominate Miriam Defensor Santiago for conferment of the Quezon Service Cross, Representative Suarez.
To the Committee on Rules.
Communication letter dated 25 September 2017 of Roger Edinho, Deputy Director, BSP.
To the Committee on Banks and Financial Intermediaries.
Committee reports report number 405 on House Bill number 6523.
To the Committee on Rules.
Report numbers 406 and 407 on House Bill numbers 6524 and 6525.
To the Committee on Rules.
Report number 408 on House Bill number 4208.
To the Committee on Rules. Majority Leader.
Madam Speaker, I move that we take up additional reference of business, and upon motion approved, please direct our Secretary General to again read the numbers and titles of the measures.
The Secretary General is directed to read the titles.
Additional reference of business committee reports. Report number 409, House Bill number 5578.
To the Committee on Rules.
Committee report number 410 on House Bill number 6528.
To the Committee on Rules.
Committee report number 411, House Bill number 6529.
To the Committee on Rules.
Report number 412 on House Bill number 6530.
To the Committee on Rules.
Report number 413 on House Bill number 6531.
To the Committee on Rules.
Report number 414 on House Bill number 6532.
To the Committee on Rules.
Committee report number 415 on House Bill number 6533.
To the Committee on Rules.
Report number 416 on House Bill number 6534.
To the Committee on Rules.
Report number 417, House Bill number 6535.
To the Committee on Rules. Majority Leader.
Madam Speaker, I move that we take up Committee Report 398 of the Committee on Ways and Means, and please direct our Secretary General to read the title of this report.
The Secretary General is directed to read the title of the report.
Committee Report number 398, Motoproprio Investigation in Aid of Legislation on the alleged smuggling of high-grade shabu to the express lane of the Bureau of Customs.
Madam Speaker, I move that we include the recommendations of the Committee on Ways in the recommendations of the Committee on Ways and Means contained in Committee Report number 398, the transmittal by the House of the said committee report to the following government agencies. Number 1, Office of the President. Number 2, Department of Finance. Number 3, Department of Interior and Local Government. Number 4, Department of Justice. Number 5, Bureau of Customs. Number 6, National Bureau of Investigation. Number 7, Philippine Drugs Enforcement Agency. Number 8, Office of the Ombudsman. Number 9, Civil Service Commission. Number 10, Philippine Coast Guard. And number 11, Maritime Industry Authority. I so move, Madam Speaker.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, I move for the adoption of Committee Report number 398.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move for the adoption of House Resolutions 1054 and 1057. They're both contained in Committee Report number 399, and upon motion approved, please direct our Secretary General to read the title of these resolutions.
The Secretary General is directed to read the title of the resolutions.
House Resolution 1054. Resolution directed the Committee on Dangerous Drugs to conduct an inquiry in aid of legislation on the 6.4 billion peso worth of shabu seized by the Bureau of Customs. House Resolution 1057. Resolution calling for an investigation in aid of legislation on the illegal entry to the Bureau of Customs express lane of more than 5 billion pesos worth of methamphetamine hydrochloride.
Madam Speaker, I move that we include in the recommendations of the Committee on Drugs, Dangerous Drugs contained in Committee Report number 399, the transmittal by the House of the said committee report to the following government agencies. Number 1, the Bureau of Internal Revenue. Number 2, Dangerous Drugs Board. Number 3, Philippine Drugs Enforcement Agency. Number 4, Department of Justice. Number 5, Office of the Ombudsman. And number 6, the Civil Service Commission. I so move, Madam Speaker.
Any objections? The chair hears none. The motion is approved.
Madam Speaker, I move for the adoption of House Resolution numbers 1054 and 1057.
Any objections? For the adoption of this. As many as those in favor, please say aye. As many as those who are against, please say nay. The ayes have it. The recommendations containing in committee reports number 398 and 399 are hereby approved as amended. As amended are hereby approved.
Madam Speaker, I move that we adjourn session until tomorrow, October 4 at 4 o'clock in the afternoon.
The session is adjourned. until 4 o'clock tomorrow, October 4.